Welcome. Today we are going to talk about Medicaid, better known as Medi Cal here in California. Our focus will be on how having a job or earning income can affect your Medi Cal benefits. This session will give you an overview of the program and help you understand what options are available if you plan to work and want to keep your health coverage. Important note for everyone. Before we start, this presentation doesn't determine if someone may be eligible for Social Security disability benefits or other government services. The information presented today is general and may not include the most recent changes related to today's topic, including annual income limits. Rules and programs can also change with new laws or updates, which may not be reflected in today's presentation. We recommend that you consult directly with Social Security, a work incentive planner, or other professionals to get accurate information that best fits your personal situation. Let's get started. Medi Cal is a health insurance program designed to help people with low income. It covers various medical costs, making healthcare easier to get. Each state has its own version of Medicaid, with different rules and services. Let's find out how it works and who can get it. Medi Cal is California's version of the federal Medicaid program. It is a partnership between state and federal governments. The federal government helps pay, but states run the program. The states provide the services, and the federal government reimburses a portion of the costs. Because of this partnership, each state has its own set of rules and services, making every state Medicaid program unique. Now, who can get Medi Cal? Medi Cal is designed to help specific groups with low income, such as children, pregnant women, seniors, and people with disabilities. In most states, including California, if you receive Supplemental Security Income, or SSI, you are automatically eligible for Medicaid. SSI is a program that provides financial assistance to people with low income who are elderly, blind, or disabled. In 41 states, if you receive SSI, you automatically qualify for Medicaid. However, in 8 states, you must apply separately for Medicaid even if you receive SSI. In Section 209B states, Medicaid eligibility is not automatic for SSI recipients. In these 8 states, Connecticut, Hawaii, Illinois, Minnesota, Missouri, New Hampshire, North Dakota, and Virginia, the Medicaid eligibility rules are different and sometimes more restrictive. If you live in one of these states, you may need to meet extra requirements. Many people worry that if they start working, they will lose their Medi Cal. The good news is that's not the case. Thanks to a rule called 1619B, you can work and still keep your health coverage. Even if earnings reduce your SSI payment to zero, you keep Medi Cal. This rule is designed to support people who want to work, so you don't have to choose between earning money and keeping health care. To qualify for the 1619B work incentive, you need to meet several criteria. First, you must continue to meet the SSI disability or blindness criteria. Your unearned income and resources must still be within SSI limits. Additionally, you must have received SSI payments or been eligible for 1619B at some point in the last year. If your earnings are above the state's 1619B threshold, you may still qualify by calculating a higher individualized threshold. This involves adding several factors, including a base amount from Social Security's threshold chart, your state's Medicaid amount or your actual Medicaid expenses, any impairment-related work expenses or blind work expenses, money set aside in a PASS plan, and the cost of publicly funded attendant care. If you plan to earn more than your state's 1619B threshold, you can ask Social Security for an individualized threshold determination. Social Security will contact the Department of Health Care Services, or DHCS, which is California's state Medi Cal agency, to get information about your actual Medi Cal expenses. They should already have details about your impairment-related work expenses, blind work expenses, and PASS account. One of the great benefits of the 1619B work incentive is that it allows you to move freely between SSI payment status and Medi Cal only status. This means you do not need to reapply for SSI each time your SSI benefit payments stop and then resume. This provides a safety net that encourages you to take jobs, even if the job stability or hours are uncertain. For those who exceed the income or resource limits of the 1619B program, the Medicaid Buy In or MBI program can provide continued Medi Cal eligibility. This program is available in more than 40 states and often involves paying a small monthly premium, and you can still keep your coverage while working. To be eligible for the MBI program, you generally need to be between 18 and 64 years old, although some programs have no age limits. States set their own income and resource limits, often up to 250% of the federal poverty level. You must also meet the medical criteria for disability under the SSI program, but your earnings above the substantial gainful activity level will not affect your eligibility. Let's review the main points from today. Medicaid helps people with low income get health care. Most people who receive SSI automatically qualify for Medicaid. The 1619B program allows you to work and keep your Medicaid coverage. Some states have different eligibility rules, so it is important to check your state's requirements. Finally, if you earn more than certain income limits, the Medicaid Buy In program may allow you to keep your health benefit coverage. Staying informed helps you make good choices for your health and your future. Thank you for joining to learn about how Medi Cal and work can work together. In our next session, we will explore how SSI allows you to build financial security through specific exclusions, rules that let you save money or own certain assets without losing your benefits. We will look at how those exclusions can support your long-term goals. If this is your first time viewing one of these sessions, go to the California DOR website at www.dor.ca.gov and click on Programs for Social Security Beneficiaries link, and then click on Benefits to Independence 101 link to begin the program and learn more about other helpful topics. You have now finished Session 10 of Module 2 in the Department of Rehabilitation Benefits to Independence 101 program. Before you go on to Session 11, please go back to the Benefits to Independence 101 page to do the activities and look at all the resources we talked about in this session. We are happy to continue this journey with you in Session 11 as we build on what you learned today.